Welcome to this channel, Clinic Wahala, by yours truly, Dr. Catch. By popular demand, today we will be talking extensively on stroke. I've had a couple of short videos about it and questions are plenty. People have asked so many things about stroke. What causes it? What can I do? How does this stroke happen? To whom does it happen to? So many questions abound. So today we'll do a little bit of a series, so it's going to be a little bit extensive too, about stroke. And like I mentioned, this channel is not really an academic resource for medics and all. It's created to bring this information in simplified ways so that the layman can hear this, understand it, and work with it. So pardon me if I am using the unprofessional language. It's just so that everybody will follow. So let's get down to the meat of the matter. Stroke. What is this thing we call stroke? Many people say stroke means so many things, but for the man on the street, I want to say it's an acute incident. It's a sudden incident that happens when there is a loss of blood supply to a portion of the brain. Yes, a small portion of the brain. It may be the big portion of the brain, but a portion of the brain, there is a sudden loss of blood flowing to that particular area, and it will now manifest as loss of function of the body. So what happened in the brain manifests as loss of function of the body. What do I mean? I believe we all live in houses. Nobody lives in a cave. So there is the electrical network and setup of every house. There is something they usually call a distribution box or a junction box in the house. Many of us may not recognize that, but when you have electrical faults in the house, you will see the electrician come to a box, open the box. He will turn off. There are many switches inside that box. If he turns off a particular switch, lights and fans and maybe AC and electrical devices in some areas of the house will go off. If he turns it on, they'll come on. So just one switch in the box is turning off many appliances in different areas of the house. So these appliances are, so to say, connected by wires and now wired into that particular switch, so that apart from the switches you use in putting the fridge, fan independently on in the house, there is a central switch in that distribution box that once it's turned off, all those things go off irrespective of their individual switches. So you can have that picture in your head and picture the brain as the junction box, as that distribution box where the current come and passes through wires, which we call the nerves, and goes down to go and supply different areas of the body, hand, leg, to do many things, feelings, so many things in the body. So when there is a problem and that switch is off, it affects those areas of the body where it gets its connection from. So that's how stroke happens. And what affects this junction box or the distribution box, there is a limitation or blockage or stoppage of blood supply to that particular switch in the distribution box. So when that happens, that distribution box goes bad. So once it goes bad, the areas which is supply starts misbehaving, can go flat. There may be no movement or no action, or there may be limited action. But this is simply because for the brain, the blood being supplied to that area of the brain has been blocked, has been stopped. So that portion of the brain starts dying. So once it starts dying, the manifestation happens on the part of the body where it connects to. So that's what stroke is all about. That's how stroke happens. And I will at this point also say that stroke is mainly of two types. The medical word is ischemic and hemorrhagic. One part is ischemic, the other part is hemorrhagic. Ischemic means that simply means to the layman there is stoppage. Something is blocking the supply of blood to that portion of the brain, and because of that, that portion dies, and we see the features of stroke. Hemorrhagic is the type that says that it's not about a blockage. The pipe connecting blood to that portion of the brain is not blocked. Rather, the pipe burst open, and blood now spilled everywhere around there instead of getting to the tissue. So eventually the blood does not get to that area, that switch. Even though it's not a blockage, it's just a bursting. It burst and spilled blood everywhere. That's where the word hemorrhage comes from. While the area is supposed to be supplied does not get blood. So at the end of the day, since it's not getting blood, it also dies or gets malformed. All of them, both ischemic and hemorrhagic, will all lead to death of the brain tissue, and it will manifest as weakness or changes in the body part it controls. So these are the two types of stroke. And stroke, over 90% of strokes that happen are usually ischemic type, the blocking type. Yes, that's over 90% of stroke, usually the blocking type. Stroke is very important because I think it's about the fifth cause of death, the fifth commonest cause of death worldwide, death and disability. Things that, apart from, of course, things like accidents can cause disability, but stroke is about the fifth prominent cause of death and disability. So it's something that is important because it changes one's life. Your lifestyle will obviously change. The things you could do, you may not be able to do them again. You cannot, if your work requires that you use your hands and legs strongly, it may be a problem. So it can affect your life, it can affect your work, it can affect so many aspects of your life, and that's important. That's why we are talking about stroke. We do not want to have stroke, neither do we want anybody to have stroke. So the aim is to inform you about the stroke, teach you about the stroke, so that you will not be a victim to stroke. Of course, we'll talk about the causes and the ones that we cannot help, but majority of the causes we can help. So if we can help, let us do the right thing so that we don't come down with stroke. Why am I talking about the classification into ischemic and hemorrhagic? Why? Because for the doctor, the treatment of ischemic will harm somebody who has a hemorrhagic stroke. So it's important for a medic that he must find out which type of stroke this is, whether it's a hemorrhagic or ischemic. If you treat an ischemic like a hemorrhagic, there may be problem. If you treat hemorrhagic like it's ischemic, there may also be a problem. So that's why it's important to know that there are two types mainly: the one that is a blockade or the one that is bleeding. So we will stop at this introduction and definition of stroke for now and classification of stroke. So our next topic will be, how does this stroke come about? So thank you for listening. Do well to like, subscribe, and share to people to get them informed. The aim is that every other person hears this. We may not have the chance to teach people one-on-one, but when you send these videos out, people get to learn and do better. Thank you.